Hi guys, here I am again, just finishing up a little run. So I've been talking about nose breathing and I just had a thought. So there's a segment of medicine that has known about this and sleep apnea and sleep breathing disorder, and the way that they treat it is they fit you for a face mask basically that pushes a positive flow of air down the airway to keep you in a good steady state of breathing where you're not holding your breath and oxygen is getting delivered to the tissues. They don't talk much about nasal breathing. And then you have a segment of physicians that are your ENTs and such, and they may take out tonsils and adenoids to get rid of soft tissue. Sometimes they'll even remove the uvula. It's a very outrageous, kind of barbaric type approach to it. And then there's a segment of medicine that's just always going to go for treating the disease, diagnosing you, and then giving you a medication and saying, you know, still count on the healing powers within to use this medicine to make you feel better. In the meantime, you're having to deal with a lot of side effects that these medications can create. So then where does a dentist fit in and what's going on there? So basically, if you have a small airway, or even if you don't, but you mouth breathe, your tongue's going to be enlarged. Your adenoid tissue and your tonsil tissue is going to be enlarged. And so when you lay down at night, all of that collapses on the airway. You continue to mouth breathe and everything grows in size. So where dentists fit in is we have come up with a medical oral device that basically pulls the jaw forward. Now, it's not really fixing anything, which is why I'm so passionate about this, but it does at least train you with the bone structure that you've grown into as an adult, which is why it's so important to catch children before the bones fuse and before this lower jaw gets locked in behind the upper. So this is when we can use, your orthodontist should be using expanders on the upper to expand the upper jaw and to grow it out and forward. And then in growth and development, the lower jaw will follow. So you can see they took teeth out on me, pulled everything back, and still it doesn't match my lower jaw. And then I was a mouth breather for years. Used to faint as a child, had preeclampsia twice, and no one in the medical profession could tell me why. So I'm here to tell you that this can be solved taking initiative with yourself and believing that you have the health and the ability to live a healthier life and get better oxygen flow to your tissues. And it's all by getting that airway open, whether that's through an appliance or growing it, or just nasal breathing, and that will reduce the size of soft tissue, and it won't change the size of the airway unless you're doing something to hold you forward, or like I said, grow you forward, or a surgery to move you forward. So those are kind of the ways. I'm here to help. I want to help any way I can. I'm very passionate about this, as you can tell. Dr. Childs at MaryAnnChilds.com. Just email me and we'll start this journey together.